What's up, everybody, and welcome back to Nursing Without Notes. Nurse Jared here, and today we're delving into the essential aspects of nursing management for diabetes mellitus. As we navigate this lecture series, we'll be focusing on non-surgical approaches to diabetes management. Our journey begins with nutrition, transitions into exercise, and concludes with a discussion of pharmacological interventions. So stay tuned for a comprehensive exploration of these critical topics. While the term diabetic diet is commonly heard, it's important to note that there isn't a one-size-fits-all dietary approach for individuals with diabetes. Scientific evidence does not support specific fixed ratios of carbohydrates, proteins, or fats as universally ideal for all adults managing diabetes. Instead, meal plans should be highly personalized, taking into account factors such as individual food preferences, financial considerations, cultural backgrounds, lifestyle, and various specific needs. Registered dietitians play a crucial role in tailoring nutrition recommendations, considering factors like the patient's blood glucose monitoring results, lipid levels, and A1C. For helpful guidance, you can recommend the diabetes plate method to your patients, which can be easily found through a quick online search. Although there are no set macro percentage goals to strive for, carb counting remains a practical method for managing diabetes because carbs are the primary nutrients that significantly affect blood glucose levels. Unlike carbs, fats and proteins do not break down into glucose molecules, making them less impactful in this regard. Therefore, it's essential to pay close attention to carbohydrate intake during meals and snacks. While enjoying an occasional drink is common, it's essential to be aware that alcohol can lower blood glucose levels. If your patient with diabetes chooses to consume alcohol, advise them that having 1 to 2 drinks with or shortly after meals is generally considered acceptable. However, exceeding this limit is not recommended, especially from a medical perspective. Alright, y'all, let's pick up right from where we left off at in part 2 of our diabetes lecture series. And if you haven't watched those first 2 videos in the lecture series, I do recommend going back and watching those. That way you're just up to speed with where we're at in this video. So in this video, we're going to start off with nursing management, and we're going to be looking at nutrition, exercise, and medication. So let's add in on our mind map a nursing management. Alright, so the 3 things we're looking at with our nursing management in this video are, like I said, the nutrition, exercise, and medication. So let's just branch these 3 off. Obviously, you could put pharmacological interventions or pharmaceutical interventions, but I think just to be brief, just medication will do. Pharmacology, the word pharmacology tends to freak people out sometimes, you know. We'll just stick with medication. So one of the things about this diet is there's actually no specific one-size-fits-all approach to the diabetic diet. Now, there is a diabetic diet that you're going to run across in the hospital, but just remember it's not specifically just one thing, and that it's tailored to individuals. So we'll just say no specific diabetes diet. It's very individualized, as we know, because everybody's different and they're going to require different amounts of all your macros. Let's go ahead and add in our registered dietitian as well, because they'll usually be consulted and they'll be able to give the person a really good breakdown of what they need to be focusing in on their nutrition. And we'll also recommend that they need to check out the diabetes plate method, and we'll let them know that carb counting is a very simple approach. And I don't know, let's add in some numbers. Yeah, carb counting. And we'll let them know when to consume alcohol, if any, and to not get buck wild with it. All right, there we go. I like this. Green nutrition, eating healthy. We're going to try to manage that diabetes with the diet. And these are the things that are just good to know broadly for individuals with diabetes. And it's nice and green, promoting healthy behavior within our nutrition. I like that. Okay, now let's pull up Anki. Go into our diabetes mellitus deck, and we're going to add card. We're going to stick with the closed deletion for this lesson, and we're in our diabetes mellitus deck. We have our stickies toggled. And let's go ahead and add in our tags. Diabetes, DM. And add in that glucose again just for the sake of it. Let's start off by putting up our topic at the very top of the card. Let's add in that candy again just for the aesthetics. And we'll bold that. So beneath our topic for the cards we're going to make in this video, we're going to do nursing management. That way we'll know kind of the general area that we're testing ourselves over. Now let me grab a screenshot of our nutrition slide. Now let's add in a few cards that I've made around these few things. That's going to remind us of what we need to be able to educate as far as nutrition goes. What does scientific evidence not support regarding fixed ratios for diabetes management? And I'm gonna bold this too. And I'm gonna put our answer below and close. Paste it in here. Scientific evidence does not support specific fixed ratios of carbohydrates, proteins, or fats for diabetes management. And that's because there is no specific one-size-fits-all approach to that diabetes diet. It is very highly individualized. So we'll add that in with Control-Enter. Our next question will be taking a look at what factors should be considered when personalizing meal plans for diabetes. And we know that we need to look at food preferences, financial considerations, and also we need to bear in mind cultural backgrounds and lifestyles. And you know what? Why don't we just add in a couple emojis while we're at it? So, you know, I'm a pizza guy. It's my favorite food. So I'm going to add a pizza in there. Financial considerations. Let's add in a little bit of money. And cultural backgrounds and lifestyles. Well, I don't know exactly what to add in for that because there's a plethora of cultural backgrounds. So for the sake of being neutral, let's not add an emoji. So for this card, let's go ahead and just close out all three of these. And then let's just make this one card. All right, let's add that in there. Who tailors nutrition recommendations for diabetes and what factors are considered? Well, that's going to be none other than our registered dietitian. And they're just going to be taking a look at your A1C, lipid levels, and your blood glucose levels as well. So, registered dietitians tailor recommendations considering factors like blood glucose, lipid levels, and A1C. Let's go ahead and highlight all that and then Control-Shift-C, and let's add that in. I like that. All right, up next for our nutrition is what method can be recommended for diabetes management guidance. And, you know, that's going to be diabetes plate method. That'll be a real nice quick card. Control-Shift-C. We'll add that in. Now let's add in which nutrients do not break down into glucose and are less impactful on blood glucose levels. And those are going to be our fats and proteins. Fats and proteins do not break down into glucose and are less impactful on blood glucose levels. So in turn, this makes carb counting a very practical method for managing diabetes, because carbs are going to have the biggest impact on the blood glucose levels. All right, so let's add that into our card deck. And next, let's add in what is essential to monitor during meals and snacks for diabetes management. And that is going to be the carbs. That is what we're looking at most of the time with diabetes and nutrition. Next up, what effect can alcohol have on blood glucose levels? And we need to know that alcohol does lower blood glucose levels. And lastly, when should they consume alcohol, if any? And that's going to be, they can have 1 to 2 drinks, and it needs to be with or shortly after meals because they don't want to do that on an empty stomach and run the risk of tanking their blood sugars. All right, we'll add that in. And there we have it. That'll be our nutrition cards. Now let's move on to exercise. Let's talk about the importance of exercise in managing diabetes. Now, I understand that for some of us, the idea of hitting the gym isn't exactly met with enthusiasm. While a few folks out there may be fitness fanatics, the rest of us need a little extra motivation to understand why exercise is so vital, especially for those with diabetes. You see, not all of your patients with diabetes are going to be gearing up for intense kettlebell sessions or parking lot lunges in their daily routines. That's why it's crucial to highlight the numerous benefits of exercise to inspire them to prioritize their health. These benefits include improved blood glucose regulation, reduced insulin requirements, especially in type 1 diabetes, enhanced insulin sensitivity, weight loss, lowered risk of cardiovascular disease through improved lipid profiles and increased good cholesterol, decreased blood pressure, enhanced cardiovascular function, and prevention or delay of type 2 diabetes. These advantages make exercise a valuable tool, often negating the need for medications. In the fitness community, we refer to maintaining health through diet and exercise as going all natty. Now that your patients are convinced of the benefits of exercise, it's time to provide them with essential education to ensure their safety during workouts. But wait, does everyone with diabetes need to exercise? Well, that depends on their current health status and approval from their primary care provider. Precautions and contraindications are especially relevant for patients with long-term diabetes complications, such as hypertension, neuropathy, foot lesions, and retinopathy. For instance, clients with retinopathy should avoid exercises like Romanian kettlebell lifts or heavy bar squatting, as they could inadvertently induce the Valsalva maneuver, potentially causing a vitreous hemorrhage or retinal detachment. Clients with neuropathy often have reduced pain sensation, putting them at risk for skin breakdown and joint damage. It's essential to communicate to your patients that they don't need to aim for the cover of Muscle and Fitness magazine to meet recommended exercise goals. They can achieve the minimum recommended exercise by engaging in at least 150 minutes per week of moderate intensity aerobic activity, spread over 3 days, or 75 minutes per week of vigorous physical exercise, or a combination of both. Walking, for example, is an accessible exercise that most individuals with diabetes, if not contraindicated, can perform. A mere 30 minutes of daily walking, 5 days a week, suffices to meet these minimum recommendations. Encourage them to buddy up with a spouse or friend for daily walks, promoting not only physical activity, but also social interaction. Before they start their exercise routine, patients should test their blood glucose levels. Depending on the duration and intensity of the workout, they should check their levels during and, crucially, after exercising. Exercising with low blood glucose levels can be risky, potentially affecting balance and overall health. Additionally, patients should conduct a urine test to determine the presence of ketones before exercising. If ketones are present, it's essential to advise against exercising. This suggests that their body is already tapping into alternative metabolic pathways for energy and not utilizing glucose efficiently. Exercising under these circumstances could worsen symptoms and complications. After exercising, it's critical for patients to inspect their feet, especially if they have diabetes. The increased stress and movement during exercise can lead to skin breakdown or unnoticed cuts, as individuals with diabetes often have reduced sensation. Proper footwear is essential to prevent such issues, so recommend a good pair of running shoes or tennis shoes. If a client has taken insulin, caution them not to exercise within 1 hour of administration or during the insulin peak action. Exercising while insulin is actively lowering blood sugar levels can be detrimental to their overall health. Considering the tendency for blood sugar levels to drop during exercise, it's vital to address how to prevent hypoglycemia during workouts. Here are some key points to share with your patients. Ensure their glucose level is between 80 and 250. If they plan to engage in high-intensity exercise or haven't eaten in the past hour, encourage them to have a carbohydrate snack before exercising. Keep a source of simple sugar handy in case of hypoglycemia. Always wear a medical alert bracelet, especially during exercise, to ensure prompt care in emergencies. A safety tip for type 1 diabetes patients aiming for vigorous exercise is to maintain a blood glucose level between 100 and 250 and ensure no urine ketones are present before exercising. After intense exercise, monitor blood glucose levels more frequently over the following 24 hours, as medication adjustments may be necessary due to significant metabolic and glucose level shifts. Exercise is a cornerstone of diabetes management, offering a multitude of benefits. By educating your clients about the importance of exercise and providing essential safety guidelines, you can empower them to take control of their health and well-being. All right, moving right along with exercise. Let's make exercise a light blue, because I like to exercise outside. It reminds me of the sky and kind of a nice color. I like that. All right, let's start off by adding in the benefits of exercise. Now, with the benefits of exercise, this isn't something you're probably going to get tested over. However, this is going to be very beneficial information when it comes to providing education for your patients. So let's go ahead and jot it down just because it's good to know. And I do understand that sometimes exercise can be very challenging to get started. However, as we're providing this very insightful patient education, it's probably not a bad idea for us to also, as nurses, keep this in mind for our own health as well, to maybe even give us a little extra motivation on those days we don't feel like doing any exercise. And I'm broadly speaking to me right now because I've been kind of slacking off lately. Nevertheless. So I like this. Now let's add in our client education concerning exercise. Now this is going to be the education we provide to the client concerning their exercise. That way we can ensure their safety while they're exercising as well. First things first, we know that it's based on their individual health. So we're going to know that it's 150 minutes per week. So they're going to need to test their blood glucose levels, so we'll add that in there. We're going to monitor the ketones. Maybe we'll put water there to indicate some urine. We'll use a faucet. And then we're going to need to make sure we inspect those tootsies. So we know they need to wear appropriate footwear, so let's just put in good kicks. We'll let them know that they do not need to exercise within an hour or peak action of their insulin. Now, lastly, let's make a branch that goes over how to prevent our hypoglycemia. And we'll put that underneath the concerning exercise here. How about we just put preventing hypoglycemia? We got something sweet here we can put. Candy. Yeah, let's do that. I like the look of that. Alright, so the first thing to know is blood glucose needs to be above 80 and under 250. Next, we need to let them know if it's going to be a high intensity workout or it's been an hour since they've eaten a meal, they need to consume a carb snack. So we always need to let them know to keep a simple sugar handy. And that can be in the form of a candy or anything. We'll put a chocolate bar. So this is going to be very important to keep that medical bracelet on, because in the event there is an emergency, this is going to ensure proper treatment and a timely treatment at that. So we got these two safety tips to know. All right, so we need to teach those type 1 patients that when they perform vigorous exercise, they need to have their blood glucose levels between 100 and 250 and no urine ketones. And also no ketones as well. And also we're going to have them monitor their blood glucose more frequently over those next 24 hours. All right, just a couple little safety things there for us to know and to visualize. So now let's head back on over to Anki and start making our exercise cards. All right, so let me grab a screenshot of the benefits of exercise. And like I was talking about over there on the mind map, This is probably not going to be something that you're going to be tested over in class. However, this is probably going to be worth its weight in gold when you are speaking with these patients. With the knowledge of these benefits, it will help motivate to keep up a good exercise routine. So let's just add those in. We don't have to make the cards very complicated. Let's just make a couple to remind us of those benefits so that when we are speaking with patients, we'll be able to deliver that good quality client education that's going to encourage them to keep up with their exercise routines and provide better health education and provide ourselves with good education surrounding the benefits of exercise. So what are the benefits of exercise? And let's put our little let's put our running shoe there, maybe a bicycle, and I'm just going to copy in our PowerPoint over here the list I made. All right, in order to not make these cards so difficult, let's just give ourselves some hints with a first word or so. So we've got 8 cards here that we could make, but since we're giving ourselves hints, and this is not really something I foresee to be on an exam, but don't quote me on that. I don't know what your instructors might want. I just know that we didn't necessarily cover this so much on an exam. It's good to know, I guess. But don't quote me on that. It's still good to know. Let's just go ahead and make 2 cards, and we'll change these first 4 to 1, and then we'll change these last 4 to C2. All right, there we go. Let's just add that in. We'll make 2 cards over the benefits. Okay, moving on down to our exercise education. Let's start off with exercises based on individual health. So we'll take that slide. And I've already got a nice little question here for us. Do all individuals with diabetes need to exercise? Well, no. Not all. Not all do, because that's going to depend. So not all individuals with diabetes need to exercise. It depends on their health status and approval from their primary care provider. And that is very true. But for the most part, exercise is always good. But it just does depend on individuals and their health status. And they do need to get cleared by their physician before they start getting buck wild in the gym. Next up, we have the amount of exercise that we need to do per week. So let's make a question that's going to remind us of what those numbers are. So before we move on to how many minutes or hours we need to work out per week, let's talk about those individual concerns for people that may have retinopathy or neuropathy and what they should avoid doing. And let's make a couple cards over that. So what exercises should clients with retinopathy avoid and why? Well, that's going to have everything to do with that Valsalva maneuver. So, like whenever you're constipated and you're sitting on a toilet and you're straining, you can almost feel your eyes pop out. I don't know if you've been there or not before. I assume possibly you have in any way. So if you're doing any type of heavy lifting like those Romanian kettlebells in the gym, or you're doing squats or anything that's going to inadvertently cause that Valsalva maneuver, that's going to be what somebody with retinopathy wants to avoid. I just added those 2 exercises in as an example because they might be something you do know or maybe don't. It really doesn't matter exactly what type of, it's not really the specific exercises we're concerned with. It's just we don't want to inadvertently do that Valsalva maneuver, which is going to put pressure in the eyes. And so we want to avoid that. So clients with retinopathy should avoid, and we'll put exercises like Romanian kettlebell lifts, heavy bar squatting to prevent inducing the Valsalva maneuver, which can cause vitreous hemorrhage or retinal detachment. We all want to make those gains in the gym, and I get it. But in this case, we gotta tone it down just a notch and not get too crazy on those squats. All right. All right, let's add that. All right, let's add that in there. That's kind of a big card, but when we go to answer this, you just want to know, don't do anything that has the Valsalva maneuver. we just don't want to do anything that's going to elicit that pressure within the body. So we'll add that. Now let's look at our neuropathy patients. We know that they're not going to have that sensation like they used to. They need to be real careful for skin breakdown and joint damage. So let's add that in there to remind us. Neuropathy can lead to reduced pain sensation, putting clients at risk for skin breakdown and joint damage. Exactly. And that's why it's important for these patients to frequently inspect their feet to make sure there's no type of cut or breakdown that's going to put them at risk for infection. Because with the diabetes, they're already going to be have that delayed wound healing. Okay, now let's move on over to the duration of exercise that these individuals need to participate in. What is the minimum recommended exercise for individuals with diabetes? So that's going to be that 150 minutes per week of moderate intensive aerobic activity divided into 3 days, or 75 minutes per week of vigorous physical exercise. And honestly, that's not too bad if you recommend them, partnering up with their spouse or a friend or a neighbor that just wants to get out of the house for a little bit a day and stretch those legs and hoof it around the block a couple times. It's good for the heart and soul and for the body and diabetes. So, just kind of present different ways if they're reluctant to want to get out and do something. You can be like, hey, it's a really good time to, chop it up with your friend or just really kind of clear your mind. There's a lot of benefit to getting outside and walking around the block for 30 minutes a day, believe it or not. All right, let's add that in. So moving on down the line, we do know that they need to test their blood glucose levels before, during, and after their exercise. And let's go ahead and just tailor a card reminding us of that. And actually, let's gear it to why they should be doing that. Why should clients test their blood glucose levels before, during, and after exercising? Well, and that's just going to ensure safety, to be honest. Safety is always a top priority. Testing blood glucose levels ensures they are safe to exercise, as low levels can affect balance and overall health, and that's extremely important. Now, I know this is seemingly a long answer on the backside of this card, but just know that you can answer this question by just saying, to ensure safety. This just gives you a little bit more context. That's why I'm adding this in here. This technically doesn't go against the minimum information principle, just depending on how you look at it. But if I'd already done this card before, I'm probably going to look at this and be like, yeah, to ensure safety, and then just keep moving on along. So let's add that in the mix. Now, there's not going to be any exercise if urine ketones are on board. So let's just go ahead and make sure we are reminded of that. So what should clients do if urine ketones are present before exercising? Don't exercise. That's the answer to that question. Now back to what I was saying earlier about the feet. Let's go ahead and make a card over that to make sure they're inspecting the feet every day. Why is foot inspection critical for clients with diabetes after exercising? And we already know they've got that increased risk for skin breakdown and cuts and all that other good stuff. And they have poor wound healing, ostensibly. So we really need to make sure they're checking their feet throughout the day, and especially when it comes to exercising. Because I know that even after I get through exercising, sometimes I might get a little blister here and there, depending on how hard I go. Yeah, foot inspection is critical. Let's add that in there. We do need to remind them to have that appropriate footwear and have a good pair of kicks on. Now, to remind us that they need to wear appropriate footwear, let's just ask a simple question and say, should individuals with diabetes wear sandals during exercise? No. Wear appropriate footwear. Don't need any damaged shoes, damaging feet. So, should individuals with diabetes wear sandals during exercise? No. Wear appropriate footwear. Now, next we want to let them not to exercise within 1 hour of administration or near that peak action of their insulin. When should clients avoid exercising if they have taken insulin? And let's bold avoid. So clients should avoid exercising within 1 hour of insulin administration or during its peak action. And let's go ahead and close that off and add that in there. Now let's move on to preventing hypoglycemia during exercise and what actions these individuals should take. Let's start with they need to keep their glucose between 80 and 250. We'll add that slide in there. And how should clients maintain their glucose levels? And they need to keep it between the 80 and 250. And we'll add that in. So if it's going to be a high intensity exercise or it's been an hour since they've consumed a meal, they need to go ahead and consume a carb snack before they get started. So what should clients do before high intensity exercise or if they haven't eaten recently? And that's just going to be have a carb snack. Everybody loves a carb snack, you know. So the next piece of education you want to let them know is to keep that simple sugar handy just in case they got to pop a few carbs in real quick. So what should clients have handy during workouts? Keep a source of simple sugar. Now next up is more of a safety concern, and that's going to be to wear that medical bracelet. That way, in case of an emergency, proper treatment can be administered. So what accessory is recommended during exercise? And that will be to wear a medical alert bracelet. And that's just a very good precautionary measure to take while exercising for these individuals. And let's add that. And here's another one of our safety tips, and that's going to be that type 1 diabetics need to have their blood glucose between that 100 and 250 range, and that no urine ketones are present at the time of exercise. We'll add what is our safety tip for type 1s. What safety tip is crucial for patients with type 1 diabetes aiming for vigorous exercise? And that's going to be just keeping those blood glucose levels tight within that 100 and 250 range, and then also ensuring there's no urine ketones. So after that intense exercise, they need to monitor their blood glucose levels more frequently over the next 24 hours. What should clients do after intense exercise? And that will be to monitor blood glucose levels frequently for 24 hours afterwards. Let's put in afterwards. And now let's move on to our medications. Let's delve into the world of diabetes medications and discuss what to do when blood sugar levels get buck wild. While insulin might be the first thing that comes to mind when we think about diabetes management, there's a whole host of oral anti-diabetic medications that play a crucial role in regulating glucose levels. In this video, we'll focus on metformin, the go-to drug for type 2 diabetes. And I'll save the details about other medications for future pharmacology videos. First and foremost, it's important to remember that oral anti-diabetic medications are typically considered when diet and exercise alone can't maintain desired glucose levels in clients with type 2 diabetes. These medications are usually initiated at a low dose for 1 to 2 weeks, ideally aiming to continue with the lowest effective dosage. If for any reason the max dose of the initial drug isn't sufficient to control glucose, a second medication may be added. Insulin therapy typically becomes necessary if all previous approaches fail. Now let's talk about patient-centered care. It's crucial to educate older adults taking anti-diabetic medications about the importance of maintaining a consistent daily intake of prescribed food and snacks. This consistency helps keep blood glucose levels stable. A quick safety tip here. Always advise patients taking oral anti-diabetic medications to consult their primary care provider before using any over-the-counter medications. This rule applies generally as well. Consult a physician before combining OTC medications with other prescription drugs. Now, let's dive into metformin, the star of the show for type 2 diabetes management. Metformin works its magic through various pharmacological actions. It achieves this by decreasing glucose absorption in the intestines, reducing the liver's production of glucose, and enhancing insulin sensitivity. However, metformin does come with a few potential adverse reactions, so it's crucial to inform patients about these in advance. These side effects may include nausea, vomiting, diarrhea, a metallic taste in the mouth, decreased vitamin B12 and folic acid levels, and in rare cases, lactic acidosis. It's really important to prepare patients for the possibility of nausea, diarrhea, and abdominal discomfort so they don't panic if these symptoms do arise. Speaking of lactic acidosis, let's address this potential effect. Metformin, like other biguanide drugs, can elevate plasma lactate levels, predominantly in the liver, by inhibiting mitochondrial respiration. While lactic acidosis is rare, it can be fatal. Therefore, metformin should not be administered to clients with renal insufficiency or other conditions prone to lactic acidosis. It should only be given to patients with healthy renal function. Now that we understand how metformin works and what to watch out for, let's talk about nursing interventions for clients taking this medication. As the nurse, your responsibilities include monitoring for signs of lactic acidosis, bearing in mind the symptoms of diabetic ketoacidosis and hyperglycemia, discontinuing metformin therapy if lactic acidosis develops, keeping a close eye on intake and output, frequently monitoring relevant lab values such as basic metabolic panel, BUN, creatinine, vitamin B12, and folic acid levels. Here's a crucial point to remember, very high yield. Discontinue metformin 1 to 2 days before and 48 hours after any imaging test requiring IV contrast media or surgery. This precaution is essential to prevent renal damage and lactic acidosis. Always double check the medication administration record to ensure metformin is held for an appropriate period before CT scans or surgery to safeguard patients from serious harm. Metformin comes in two forms: immediate release, PO, twice daily with meals, and extended release, PO, once daily with the evening meal. It's essential to stress the importance of not crushing or chewing extended release medications. Educate patients taking metformin to avoid alcohol, as it can reduce the risk of lactic acidosis. Encourage them to report any signs of lactic acidosis and immediately discontinue the medication if needed. Review the signs of hypo and hyperglycemia with your patient, covered in Part 2 of this series. Explain that metformin aims to control diabetes, not cure it. Lastly, prepare them for home management of hypoglycemia, a topic we'll explore in Part 4 of this series. Before administering metformin, be aware of a few contraindications and precautions. Chronic alcohol abuse, hypoxic states such as acute heart failure, shock, and myocardial infarction, and severe infection, sepsis. You can determine these conditions through the client's medical history, electronic health records, or physical assessment upon admission. Now, let's shift our focus to insulin, a crucial aspect of diabetes management. I'll provide a brief overview in this video, focusing on insulin types and their timed activity. We'll cover insulin in more detail in future pharmacology videos. Insulin is available in 4 primary forms: rapid-acting, short-acting, intermediate-acting, and long-acting. The following chart offers a quick breakdown of their onset, peak, and duration. Physicians often prescribe one or a combination of these insulins to replicate the natural insulin release pattern observed in the beta cells of the pancreas. Given the diversity in insulin types, timing, and dosages, absorption can vary significantly. Typically, insulin is administered subcutaneously in the abdomen, with the fastest absorption occurring outside a 2-inch radius from the navel. It's advisable to rotate injection sites within the same area on a daily basis to reduce absorption variability. Now we're back to our mind map, and let's start taking a look at the medications for the nursing management of diabetes mellitus. Let's do it in the purple color. I kind of like that. Our medications are going to include oral anti-diabetics and insulin. So let's add those in there. Oral anti-diabetics. And then also insulin. And insulin does act as that key in the lock and key mechanism. So I'm going to go ahead and add in the key just so we get a little bit more visual with our studying. For the purpose of this video, I'm only going to cover metformin here. However, there are several other oral anti-diabetic medications out there, and I'll cover those in other Nursing Without Notes pharmacology videos. But for here, let's just look at metformin. So let's go ahead and add metformin down here. Alright, so we're just going to be looking at metformin here. I want to make this a little bigger. Then I'm also going to put this, then I'm also going to add in a little pill here to signify that it is a PO medication. Alright, so metformin, our go-to drug for type 2 diabetes. Let's start off with a branch with its expected pharmacological actions. So let's just put expected actions up here. And the word actions just kind of makes me think of film, so we'll put an action there. And so we know that it's got 3 expected actions. That's decreasing the absorption of glucose in the intestines, decreasing synthesis of glucose by the liver, and lastly, it increases insulin sensitivity. So let's just go ahead and jot those 3 things down here. So whenever metformin is given, we can expect these 3 things to help manage that blood glucose regulation within these patients. Now let's add in our adverse reactions here. And let's put that in a red color because it is adverse. Well, let's just copy in and paste in our adverse effects here. That's going to be our adverse reactions from the nausea and vomiting and diarrhea. Got that metallic taste, our decreased B12 and folic acid. Had to monitor that because that's a big component of red blood cells. And then lastly, that lactic acidosis. Alright, next up we have our nursing interventions for metformin. And we'll go ahead and put a stethoscope there. Signify that RN title we have, or we will have. And I'm just going to go ahead and paste these in here as well. So as a nurse, we're going to want to monitor for those signs and symptoms of lactic acidosis. Obviously, we're going to discontinue that therapy if those signs occur. We're going to monitor those inputs and outputs. And lastly, we're going to check those lab levels. And that's going to be what the nursing interventions look like here for metformin. So we're really just making sure we don't have anything going on with this lactic acidosis, which will be a lot of those signs and symptoms from the hyperglycemia, because when that metabolic acidosis takes over, you're going to see those. So we're really going to be paying attention for those type of signs and symptoms when we have a patient that is taking metformin. We will monitor the INOs, which is something we do quite often as nurses, and then monitor those lab values, which if you're in the hospital, usually they're going to do those morning lab draws around 4 or 5 a.m. That way when they get in the morning, that's going to kind of determine what direction they take with the care plan and adjusting any medication levels, but that's certainly on them to do, not us. All right, let's add in our 2 last nursing interventions here, and that's do not drink the alcohol. All right, so advise against alcohol. So we're going to tell them not to drink the old alcohol. All right, so I saved the best for last. This last nursing intervention is by far the most high yield fact about metformin that you're probably going to run across. And that is you need to discontinue this medication 1 to 2 days before and 48 hours after any imaging test requiring IV contrast media or surgery to prevent renal damage and lactic acidosis. So let's add that bad boy in there. I'm going to go ahead and put a box around this just to signify like this is high yield right here. All right, this is going to let us know that we really need to commit this to memory because this is very important, especially if you're working in the acute care setting, or if you're like me, you work in surgical trauma ICU and you're constantly taking patients back and forth to the OR, and then you need to know if they're on this type of medication and to hold it after they get back from surgery as well. All right, moving on to the administration of metformin. So we know that it's PO twice a day with meals, morning and evening. And then also we've got an extended release that's 1 time daily with the evening meal. And you don't want to crush or chew that, obviously. That's our administration. Now let's plug in our client education concerning metformin and those things that you're going to need to talk to them about. And we'll put the books there. And I'm going to go ahead and just paste in our slide here. So if you can't tell by now, alcohol is usually recommended to avoid in a lot of medications, which I know can be a big bummer for some. So we're going to report any of those signs of lactic acidosis and stop that medication. We're going to go back over those hypo and hyperglycemia symptoms that we went over in part 2 with the patient, so that they know what they're looking for as well when they're at home and out and about in the community. We're going to explain that metformin is not a cure, it's just a control. And then lastly, we're just going to teach that home management of hypoglycemia, that 15-15 rule, all that good stuff, glucagon. All right, lastly, let's put in our contraindications and precautions. Let's put that alert symbol back in there. These are the 3 things we need to be on the lookout for before we start administering this medication. And as you can see, there's alcohol again. Then we got our hypoxic states with acute heart failure, shock, and MI. And then lastly, we have our severe infection, which is usually something like sepsis. All right, those are the 3 things you need to kind of keep an eye out for before giving metformin. There's contraindicated and a precaution. All right, now let's jump over to our insulin just real quick. Now let's just take a look and jot down the 4 types that we're going to look at in today's video. I will be making future videos on all the pharmacology on diabetes mellitus. They'll go back in over that oral antidiabetics and our insulin therapy. So for now, let's just add in our 4 types that we're looking at in this video, or this lecture series rather. All right, there's our 4 types of insulins we're going to be looking at. And like I said, I'm going to be going further into insulin and the other medications in other videos. But for now, let's just note that these are our 4 types of insulins. And then we've got metformin over here on the oral anti-diabetic side for the pharmacology aspect of our diabetes mellitus for now. I'm going to kind of move this in maybe right over here. Let's take a look at how our map's coming along. All right, let's pop back over to Anki. Now let's look at oral anti-diabetics. Let's go ahead and add that PowerPoint in there. And right below here, I'm going to add in pharmacology. So the first thing with the oral anti-diabetics is they are only indicated with type 2 patients when diet and exercise hasn't been able to maintain those desired glucose levels. So let's make a card about that. When are oral anti-diabetic medications typically considered for type 2 diabetes management? And so that's just when that diet and exercise isn't getting the job done. So let's add that in there. So there was also talk about the dosage when it got started. So how's the dosage of oral anti-diabetic medications usually initiated and adjusted? Usually started at that low dose for 1 to 2 weeks. And then the overall goal is to stay on the lowest effective dosage. A second medication or insulin therapy may be added if needed. We'll just jot that in there. So when you're educating your patients about maintaining this daily food intake and at the same time, let them know by doing this it's going to keep those blood glucose levels stable throughout the day. We can say consistent daily food intake helps keep blood glucose levels stable. And we'll add that in. Now this is always just a general rule about the over-the-counter medications. You always need to consult the primary care provider before taking any of these OTC medications with prescription drugs. What safety tips should patients taking oral antidiabetic medications follow regarding OTC meds? Patients should consult their PCP before using any OTC medications. Like I said, that's just a general rule for any medication. All right, now let's move on along to metformin. All right, to kick things off with metformin, let's look at the expected pharmacological actions. And then let's also add in metformin as a tag down here. That way, if we ever want to study specific medications in isolation, We've already got the cards tagged, and we can make a custom study deck. So let's start off here with the expected actions. And let's say, what are the expected actions? And for this card, I think I'm going to make it one card. I'll just leave the first word in each three of these pieces of information. So let's just start with the absorption here, and synthesis, and insulin sensitivity. And let's change all these over to 1. And we'll just make this one card, leaving the first word here to give us a hint on all three pieces of information. Now let's make a card over the adverse drug reactions. The thing is that in nursing school, sometimes it's just pure memorization with all these facts that you have to know. And so with cards like this, we could come up with our own little mnemonic to maybe remember this. But I've always found that maybe just separating it up, maybe let's make this into 2 cards. And I'll just leave that decrease there, and then maybe lactic acidosis. Let's just make this 2 cards, do this C1, give ourselves a hint on this back side, or this second card rather, and then we'll do C2. Now that's going to give us 2 pretty simple cards to commit the adverse drug reactions of metformin down in a fairly easy manner. Like I said, we could come through and maybe come up with some sort of saying here or something around this metallic taste. But I think that just having these 2 cards, we could be able to just memorize this. We'll go ahead and make a card on why we see this lactic acidosis to understand the why here, which is why we're seeing these signs of metabolic acidosis. So let's add that there. Now speaking about that lactic acidosis, now let's make a card over why that's a concern. Why is lactic acidosis a concern with metformin? And the reason is that it inhibits the mitochondrial respiration predominantly in the liver. So let's put that in there. Metformin, along with other biguanides, inhibit mitochondrial respiration mainly in the liver. And that'll give us just a little reminder of why we're looking out for lactic acidosis with metformin. We know that metformin should only be administered in patients with healthy renal function and are not prone to lactic acidosis. So let's make a card to remind ourselves of that. That way we know what to look for in the health history before administering metformin. All in all, metformin disrupts the liver's ability to reuptake lactate. Thus, if renal function is impaired, both metformin and lactic acid build up in the bloodstream and are not excreted properly. And so that's why we're going to need to have that healthy renal function, and they're not prone to this lactic acidosis. And you know what? I want to make this red while we're at it. Moving on along to the nursing interventions. So for this card, for the nursing interventions, I'm just going to put metformin nursing interventions, and then we'll close delete out each individual intervention. That way we don't have to make a bunch of questions for each one. We can just see it all on one card, which I think is easier for the nursing interventions when it's concerning just one medication. So let's put metformin nursing interventions. And I'll just copy and paste in from our PowerPoint. Okay, now here's all our nursing interventions for metformin. And I just went ahead and put both of our PowerPoint slides down here. And we've got 6 pieces of information here, or 6 interventions. I think what I'm going to do is split this up into 3 cards, doing 2, 2, and 2. I think that'll make it really easy when we're going through and answering these cards. That way we don't have to stop and answer all 6. We'll just do something like this. Now to make 3 cards, let's do the C1 and 1. Then make these 2 C2. And I'm going to bring that back up there, and then we'll make these our 3rd card. Alright, cool. That's going to give us 3 cards over those nursing interventions, and then we'll be able to see them all in one place. Alright, now on to the administration of metformin, and we'll just do this right here, administration. And I swear y'all, this girl looks just like that girl in The Office, the secretary, Erin. That's her name, I think. So let's take our 2 routes that metformin goes by. And instead of asking questions about these two, I'm just going to make one card here for both. We've got our PO route, which is twice a day with meals, and then our PO one daily in the evening meal. Don't crush or chew, and we'll just make one card for this. And this will be our administration card. And then we'll do the same thing with the client education card as well. Now let's make a couple cards here to remind us of the client education. Now looking at all 5 pieces of this information, I think I'm going to lump the avoid alcohol and the report signs of lactic acidosis together. We'll just make that one card. And then we'll just do the education over reviewing the symptoms of hypo and hyperglycemia, and then explaining that it's not a cure, and also that home management. We'll just make that all one as well. So we'll just make all this one card as well. So we'll have 2 nice cards over the client education for metformin. Now let's jot down the contraindications and precautions. And we'll stay within that same fashion. We'll just put our 3 points there of what we need to look out for. And then make one card for that. So all right, that gives us a nice card for contraindication and precautions for our metformin. And that'll wrap up metformin for us. Now let's move on over to insulin, and for this video we're just going to be looking at the onset, peak, and duration of those 4 types we went over in our mind map. And I'll show you 2 different ways to go about plugging these values in. We'll do the image occlusion, and we'll also do the closed deletion form. To get started with insulin, let's take off the metformin tag and let's just type in insulin. I took a screenshot of our insulin table here in our PowerPoint. Let's do the closed deletion version first. So let's do Human List Pro. So for each of these insulins, you're going to have the onset, the peak, and the total duration. All right, we got those plugged in. Let's go ahead and just close each of those off. And let's just make it one card. All right, there we go. We've got that added. Now we'll do our regular insulin. Now moving on to our NPH, or our intermediate. And last but not least, we've got glargine, which is our long-acting. Now that's one way of adding in all those insulin times as closed deletion cards. Now let me show you how you can make those same cards using the image occlusion tool and the chart. So let me pull it over here and I'll show you. So here I'm going to take a screenshot of our insulin chart. Now that we've got that screenshot of the insulin chart, we'll come up here on our Add Card window and hit Add Image Occlusion. We're going to go ahead and maximize that, and I like to come down here and hit Fit to Canvas and expand this view. We have our rectangle tool highlighted, and then I'm going to choose a color down here. Now what I'm going to do is put an occlusion and blot out each of these times, and when I do that, this is going to create an individual card. And so we'll do all 4 here. So down here at the bottom, I'm not going to hit hide one, guess one. I'm going to select hide all, guess one. That way I'm able to test myself individually on each one of these insulin types and not inadvertently look at the answers to all the other 3. So now I'm going to hit hide all, guess one. And as you can see here, I've added 4 cards. And now we've got 4 cards that we can test ourselves over the chart, which is essentially the same thing we did here with the closed deletions. It just depends on how you'd like to do it. Now obviously that image occlusion tool is substantially faster, but sometimes I do like to set up the cards this way, depending on if I have the time or how I'm feeling, honestly. But you have access to this deck, so you can have both. So let's jot down just a couple last things about insulin here. All right, let's go ahead and jot down, why might physicians prescribe a combination of different types of insulin, since there are so many? So we could answer that by saying physicians might prescribe a combination of insulin types to replicate the natural insulin release pattern observed in the pancreas's beta cells. And we'll just jot that down so we can just keep that knowledge handy. And then one last thing to note here, let's also add in, where is insulin typically administered and how can absorption variability be reduced? So this is a bit lengthy, but we'll add it in anyway. Insulin is typically administered sub-Q, the fastest absorption, with the fastest absorption occurring outside a 2-inch radius of the navel. And then rotating those injection sites within the same area daily can reduce absorption variability. And so what we can do is we can just highlight all that and put that in one answer. That's a bit long, but we could answer this 2 inches outside the navel and rotate sites. So we know that we need to do it 2 inches from the navel and then also just rotate sites. And we'll just make that one card, C1 and 1. And all right, there we have it. All right, now to wrap up part 3 of making our cards and our mind map, let's go ahead and add in a screenshot of our mind map on the back side of our cards. That way we can just visualize all the connections we've made on our mind map with the information as we've gone through this lecture series. This way, when you're flipping through your cards and you're honing in on those isolated facts, you can see on the back side of the card, you can go ahead and see where that's at in relation to the broader picture. So let's go ahead and do that. I just want you to see that after you make your mind map, that you can go back in and use that browse feature on Anki. That way you can go ahead and add in that map on the back side of your cards that you made. Just that way you can see your map as you're studying your cards in Anki. Now our map's getting a little bit big here, so I think what I want to do is maybe take 2 screenshots and then stack it on top of each other in Anki. So let's do that. Now let's grab 2 screenshots and I'll try to make this as clean as I can. All right, we'll do that. We'll come back over to Anki. Let's go into our browse feature in our diabetes mellitus deck. And we'll just start here on top with the pharmacology card. I'll paste that screenshot. Now let me grab a screenshot of this bottom part. And I think that's going to be, I think that'll do. And I'll add that in below. And let's just see what that's going to look like on a card. So this would be the front part, and then on the back we would reveal our answers here, and then we could scroll down and see our mind map. And obviously this is a little bit off, but I think this gives you a general idea of where it connects. So if you're the one making the mind map, you would know that nursing management connects right here to diabetes mellitus. Also, by using the separate colors, you'll know that this is the nursing management. Now you could just do just the nursing management here. If you want to delete this part, that's fine. I'll just add it in there just so you'll have it. So I'll go ahead and add those 2 screenshots on the bottom of the rest of our nursing management cards. All right, well that'll do it. We've got our mind map added to all our cards, and then that way we're going to be able to see that beautiful mind map as we go through and study our cards, and not just study the isolated facts, but also go ahead and visualize all those connections that we've made throughout our lecture series. Well, that's going to be it for part 3 of the diabetes lecture series. I'll see you in the next video. Thank you for joining me on this informative journey through various nursing strategies for diabetes mellitus. We've covered a wide range of essential topics, from personalized dietary approaches to the significance of exercise in diabetes management, and even delved into the world of diabetes medications. Remember, there's no one-size-fits-all solution when it comes to managing diabetes. It's all about tailoring care to each individual's unique needs and circumstances. We've discussed how nutrition plans should be highly individualized, with a focus on monitoring carbohydrate intake. Exercise has been highlighted as a powerful tool in achieving better blood glucose control, along with essential safety guidelines to prevent hypoglycemia during workouts. We've also explored metformin, the go-to medication for type 2 diabetes, and learned about its actions, potential side effects, and nursing interventions. And of course, we touched upon the various types of insulin and their timed activity. All right, well, that wraps up part 3 of our series. You're doing awesome and keep up the good work. As always, if you're finding these videos helpful with your studies, be sure to like and subscribe and also share with a classmate. And I'll see you in that next video.